Hi, I'm Cheryl Ingalls. My project is on socioeconomic status and inequality in access to healthcare. Issues of diversity in modern culture have shaped social practices in modern culture in multiple ways. We can compare today's modern family to a family in the mid 20th century. At that time, the family unit would consist of a married heterosexual same race couple raising children. Today, most of society accepts a mixed race homosexual married couple raising children. People with physical and developmental disabilities are able and encouraged to work and attend school in the community. The ease of travel has contributed to the mixing of cultures and development of new traditions for families. The topic of race has definitely influenced some people in the modern society. We need to educate our peers as well as folks who grew up in an earlier era that hold embedded beliefs of racial stereotypes. As we learned in this course, all humans have the same genetic makeup. We are all equal, and race is not biologic, and we are not divided into different species as thought in earlier times. Social change has occurred with travel security after the horrific events of 9/11/01. Security had to be increased, and along with it came racial profiling. I'd like to share an excerpt written by an Iranian student regarding her personal experience with racial profiling. I quote, "I also seem to have this peculiar power to make people at airports and train stations visibly uncomfortable." End quote. Diversity has added a new dimension to nursing. As a nurse assessing a patient, I need to be aware of and sensitive to a patient's cultural, religious, ethnic background, sexual orientation, and identification. This is necessary to implement proper assessment, treatments, and follow-up care. We need to be aware of variations in skin tones when assessing for anemia and bruising on a patient, as these present differently with different skin tones. Pain and discomfort is expressed differently from culture to culture. We need to respect and include patients' diverse religious beliefs, customs, meal preparation, and food choices into their plan of care. We will encounter evidence of alternative healing methods, such as cupping and coining, and not accuse abuse unnecessarily. We might also rely on professional interpreters for communication. We should not rely on family members for interpreters. Family members and the patient might not be forthcoming due to embarrassment or omission. Modern society has changed in regarding the subject of homosexuality. Homosexuals are legally able to have a civil union or marry in a church in some states in the United States. Prior to this event, homosexual couples were not allowed to marry and mostly lived in the closet. The benefits of overcoming issues of diversity would be that we would all be more tolerant of each other and our differences. We could all learn from and appreciate our differences. We should embrace this. Just think of how boring it would be if we were all alike. If we could overcome and be more tolerant and accepting of each other's beliefs, even in small increments, it could lead to decreased unrest and wars in regards to religious and ethnic intolerance. A lot of the population still have unconscious assumptions and fears about different cultures. The biggest challenge would be to convince people to break and look past the stereotypes that have been ingrained throughout the generations. Everybody has the right to equal health care, the right to the highest attainable standard of physical and mental health. But there are health disparities in our healthcare. Health and healthcare disparities refer to differences in health and healthcare between populations. Why do disparities matter? Disparities in health and healthcare limit continued improvement in overall quality of care and population health and result in unnecessary costs. Socioeconomic status embodies an array of resources, money, knowledge, prestige, power, and beneficial social connections that protect health no matter what mechanism is relevant at any time. Meaning, if you have money, you're able to move out of an area and have easier access to health care. Many disparities exist here, and some of the main factors contributing to problems with access to health care. Many people in the US are unable to buy or maintain health care insurance due to social stratification, lack of income, from homelessness to the working poor. Those are families who are unable to make ends meet, lack of health insurance, and level of education. Lack of health insurance. Health insurance is very expensive, and people with lower income may only be able to buy a plan that limits services, medication, treatments, or providers they are allowed to see for care. A regular source of care, some groups of individuals are unable to see the same provider for follow-up care and rely on walk-in clinics or emergency rooms as their primary care provider. These emergency room visits cost money, and the bills start mounting for the individuals. There are legal barriers. For low-income immigrant groups, Medicaid is not available to them until they have been citizens for 5 years. There are structural barriers which limit people with mobility difficulties access. There are lack of healthcare providers. Age contributes. Non-elderly adults have a higher risk of being uninsured compared to children. 21% of the non-elderly adults and 10% for the children. Actually, where a person lives affects their ability to access health coverage. In Massachusetts, they have a 4% uninsured rate compared to Texas at a 24% uninsured rate. Access to health insurance by race. If you see here, the white and the non-Hispanic white have an easier access to health insurance, and access to health insurance by education and income. If you have, as you can see by the stars here, if you have some college education, you have an easier access, and your income, if you have a higher income with the blue dots, you have an easier access to health insurance. Without health insurance, people are more likely to delay or go without the necessary treatment. The target population is low or no wage earner who might have a job, but they have low wages. They might have mental health issues, addiction. They've lost employment. They may be elderly. They may be homeless. They may be shunned because of their sexual orientation, or actually their citizen status will affect that. Homeless citizens. Homelessness and healthcare are intimately interwoven. Poor health is both a cause and a result of homelessness. For example, becoming ill and losing income, as well as already being homeless and unable to access proper health care. Barriers to health care for homeless people are embarrassment, lack of ID, no knowledge of where to obtain treatment, lack of transportation. Socioeconomic status and access to health care relates to socioeconomic status and diversity directly. Socioeconomic status regulates access to quality health care and knowledge of health behavior. It is also a predictor of health. The long-term effects of adversity or stress on the body can lead to poor health. Socioeconomic status is related to multiple disease outcomes due to multiple risk factors. This is fueled by risk factors such as poor diet, inadequate exercise, and smoking. Low socioeconomic status is related to mortality from chronic disease, communicable disease, and injuries. Health promotions such as preventative screenings are not always targeted at the poor, and this is likely to increase socioeconomic disparities. You can see if you earn $75,000 or more, you are less likely to smoke. In your education, if you are a college graduate or beyond, you are less likely to smoke also. There are numerous problems with access to health care, and many disparities exist. A number of groups of people are at risk of being uninsured, people of color and low income. Without health insurance, people are more likely to delay or go without the necessary medication and treatments they need for chronic diseases. People are choosing to buy groceries or pay rent instead of taking care of their health. Curable illnesses are being ignored. The healthcare system in the U.S. needs to change. We need to be prepared for the future care of our diverse population. It will take a continuous, multidisciplined approach to manage this feat. Without fixing the inequities, healthcare costs will continue to rise. It is estimated that 30% of direct medical costs for Blacks, Hispanics, and Asian Americans are excess costs due to health inequities, and the economy loses an estimated $309 billion a year. My plan. The government has put these plans into effect. The Department of Health and Human Services developed a plan to reduce racial and ethnic health disparities. It is the HHS Disparities Plan. It's built on programs such as Healthy People Initiative, state, local, and private organizations. The Affordable Care Act was put into place on March 2012 to reduce disparities and improve healthcare access to vulnerable populations. First, I would fight to have stricter regulations, transparencies, and oversights on insurance companies. I would open more nonprofit volunteer health clinics, ensure healthcare staffing was culturally diverse to care for the population they'd be serving. I would reach the homeless population by running mobile clinics that would reach out to shelters in the streets, not only for healthcare, but to distribute healthy food and education about healthy living. I would also want mobile clinics to visit urban, low-income areas to deliver low-cost to no-cost healthcare, along with an education component to teach about healthy lifestyle. I would ensure the insurance companies are not overcharging for their services. I would like to start a program ensuring healthcare and job training for people at risk, low socioeconomic status, disabled, and elderly. I feel it should also begin training when children are in school, cradle to college. Early childhood development is important and likely to influence health. This involves school readiness, which predicts later school performance. The educational attainment and eventually predicting economical resources, employment opportunities. This plan would be to prevent people from falling through the cracks in the healthcare system. I would contact philanthropists for nonprofit healthcare facilities, run fundraisers. I'd form committees to perform oversight and activate the community to become involved in the process of changing policies instead of discussing what is wrong and blaming the government. And I would include the target population's involvement, combining the interdependence of economic and social rights. Last, my plan would bridge a gap in accessibility to healthcare by ensuring healthcare services are more readily available to the target population. Diverse ethnic groups seeking medical attention will trust providers that are culturally diverse. People will be educated on signs of ill health and learn when to seek medical attention before their condition worsens. Disparities will be dissolved, costs decrease, and ensure equal access of healthcare to all. Thank you.